Hello students, today we are continuing our third video on GIT drug. We have continued peptic ulcer drugs and today we will discuss about antacids. As we know that antacids are the drug which is only neutralize the acidic level of the GIT. So it includes some drug which is systemically work, that is systemic antacids, and some are non-systemic. So the non-systemic antacids. The difference between these two is systemic antacids are water soluble and non-systemic are not soluble. So systemic antacids include sodium bicarbonate and non-systemic antacids include megaldrate, aluminum hydroxide, magnesium hydroxide and magnesium carbonate. The mode of function of this drug is only neutralizes the acidic level of the stomach. It does not include any inhibitory function on the cells to decrease the HCl level, but it only neutralizes with the acidic content of the stomach. Another eat little bit inhibit the secretion of pepsin. So this drug now we give in a dosage of like magnesium hydroxide 0.4 gram per 5 ml of suspension. It can neutralize the 12 milli equivalent of HCl, and aluminum hydroxide of a 5 ml suspension can neutralize 1 milli equivalent of HCl. In the same way, megaldrate of 400 milligram per 5 ml suspension can also neutralizes this HCl. This drug nowadays not used in common, just it's used for heartburn and acidity that is induced by gastroesophageal reflux. It's also not used commonly because of systemic effect. Its long usage can cause alkalosis because it systemically absorbs and cause alkalosis. Second, after its solubility, it causes production of carbon dioxide gas in the stomach that can cause distension of the stomach and stomach discomfort. Further, it can also cause sodium overload in the body that can help in inducing the edema. Another type of drug that is called protectants, or we can say ulcer protectives. These are the drugs that basically protect the damaged tissues from further destruction by the gastric HCl. So it are basically protective drugs and it include sucralfate and colloidal bismuth substrate. These are the two drugs that basically protect the ulceration from further destruction. So the mechanism of colloidal bismuth substrate is basically not discovered, but sucralfate have a function. It basically covers the ulcerative areas by formation of coat and it protects further destruction from HCl. So colloidal bismuth substrate can be taken in 120 mg in tablet form and sucralfate can be taken as 1 gram before meal at the time of bed. One point should be keep in mind that this drug shouldn't be taken with antacids because the polymerization of sucralfate is depend on acidic pH. Now the last drug for the treatment of peptic ulcer that is considered as etiologic because it may be due to bacterial infection, like the most important bacteria that include in peptic ulcer, that is H.pylori. So this can be treated by giving antibiotics. So the antibiotic include amoxicillin, clarithromycin, tetracycline, metronidazole, tinidazole. These are the drugs that kills the bacteria. So this antibiotic should be given in a combination of 2 or 3 drugs because a single antibiotic can be resistant. So the regime which we can give like omeprazole 20 mg with amoxicillin 75 mg and tinidazole or metronidazole can be given. We can also give esomeprazole or lansoprazole 30 mg with amoxicillin 1000 mg and tinidazole 75 or 500 mg twice a day.